Evening. Hong Kong's COVID-19 vaccination campaign will begin next week, with the first batch of COVID Sinovac doses expected to arrive Friday. It comes after the government gave its emergency approval for the mainland-made vaccines. Perhaps the first step towards regaining some pre-COVID normality, as the city's 5 priority groups can choose to receive the Sinovac jab starting next Friday. They are healthcare staff, residents and staff at homes for the elderly and disabled, essential workers, as well as cross-border transport workers. Also among the first in line are seniors aged 60 or above. They could have 1 companion inoculated with them or 2 for those older than 70.
It's better for all of us to get the jabs as early as possible whenever there is supply, because vaccines are scarce resources. And it's not easy to get it.
Starting Tuesday, those in the priority groups can make appointments for their first dose, which could be taken next Friday at the earliest. To ensure the minimal wastage of vaccines, prior bookings are mandatory, and so far only online appointments are available. 5 vaccination centers reserved for the Sinovac vaccines will operate for 6 months, 7 days a week from 8 a.m. to 8 p.m. And after another 1 million doses from Pfizer-BioNTech arrive at the end of the month, 24 more vaccination centers will be set up for the German doses. Jabs will also be made available at 18 general outpatient clinics. Early March vaccines can also be administered by private medical practitioners. An SMS message will be sent about the date for the second dose. Those immunized might be subjected to different anti-epidemic measures.
Our experts and also internationally are also looking into all these global incentives as to whether after vaccinated people can have, for example, a shorter quarantine period, or how widely testing is to be applied.
Currently, the government has procured 22.5 million doses from 3 suppliers. Chief Executive Carrie Lam will receive the Sinovac jab as soon as next week. In around 2 months, those aged 16 to 59 with chronic diseases will be the next in line to get the shots. The city's first COVID-19 vaccine consignment was delivered from Beijing by a Cathay Pacific flight. Right after the aircraft landed, the CoronaVac kits were unloaded. Overseeing the process were Secretary for Civil Service Patrick Nip and Food and Health Chief Sophia Chan, who appealed for citizen support for the campaign.
It is indeed a very important milestone for all the COVID-19 prevention and control work that we have been doing. It's very important for us to all support, because with the vaccination, with more people vaccinated, we can ensure that the people's life can be resumed as soon as possible.
The medicine will be dispatched to designated warehouses in Kwai Chung. On the ground, the inoculation drive is also progressing. Apart from the community facilities, more than 1,500 private clinics are joining the first phase of Hong Kong's mass vaccination campaign. Among the participating private doctors is Edmund Lamb. He expects each clinic to have 50 doses of Sinovac jabs for the first round, and the stash will be replenished on a need basis. Meanwhile, the vaccination pilot scheme will also be underway at 10 elderly homes. Kenneth Chen, chairman of the Elderly Services Association of Hong Kong, says residents need to fulfill 2 requirements to be eligible for the shots: approval from their family or guardian and a doctor's health assessment. For those without a guardian or unable to make their own decision, another assessment list will be used to determine their suitability. To further protect the elderly, Chen suggests incentivizing care home staff to take the jabs by waiving their current bi-weekly COVID test requirements and a further relaxation of visitation rules for elderly facilities that have more than 90% vaccination rates. Still, questions remain as to whether the benefits of vaccination outweigh the risks for these vulnerable groups. The civil service chief says the government's advisory panel will discuss that further.